Despite a series of warnings about a third wave of the COVID-19 pandemic and the daily record of cases in Lagos, research has shown that most residents in Lagos believe the virus is not as severe and deadly, and worse off is the belief that it is not even real. In a research conducted by the Partnership for African Social and Governance Research, findings show that the government is the most distrusted for information on the virus. And Sarah Yehu reports.
Since the outbreak of the coronavirus pandemic in February 2020, Lagos has lost 456 persons, the highest among 36 states and the FCT Nigeria. The latest surge in coronavirus infections rises with 535 confirmed cases. This is the highest figure in 4 months following the spread of the more contagious Delta variant. The surge is worrisome for government officials, health experts, and those in the academia. In a research conducted by a Kenya-based research team and academics in Nigeria, understanding the relationship between COVID-19 misinformation sources and low adherence to preventive and vaccine-related measures is examined to assess the impact of conspiracy theories.
Made surprising findings. Studies all over the world and even experiences have shown that COVID-19 is affecting men and women differently. But we found that men and women are believing COVID-19 misconceptions in the same proportion, which will have a great deal of implications for women.
The objective of this stakeholder engagement workshop is to influence policy uptake on COVID-19 preventive measures in Lagos State. The study is based on a telephone survey of men and women of 1,000 households in the state.
People trusted the mass media, they trusted even social media actors more than they trust the government. So government needs to look at the approach. It is not compulsory that government should be at the forefront of COVID-19 information dissemination. Trusted actors should be engaged. It should be a collaboration.
From what is happening all over the world, it seems the third wave is more brutal than the first and the second wave. And so if you want to ensure that people comply with all the preventive measures, then ensure that provisions are made, especially for people who are in the informal sector. Majority of Nigerians are in the informal sector, and especially for women. And so if you're asking people not to go out, as they've done in the developed world, make sure you provide measures, means by which they take care of their families within the provision that is available for the government.
Key findings of the research reveal that 4 out of every 10 respondents believe that the virus is no more than common cold or flu. Although about 86% claim that the virus is not widespread in their neighborhoods, majority of them are either extremely or somewhat worried by the likelihood of contracting the virus and falling seriously ill as a result of that.